tonight, I'll be taking us on Ocular Pharmacology 1. This Ocular Pharmacology is a vast part in optometric practice. So I divided it into 3 parts. So the first part will be taking it today, and then I will fix subsequent classes for the other parts. So the first part, we'll be talking about, we'll be discussing on the clinical guides to ophthalmic drugs. So we're looking at pharmacokinetics, things that affects drugs, how drugs works, the stability, things that can affect the stability, and prescription writing for drugs, and also some classes of drugs. Then in our next classes, we can now begin to go deep into these classes of drugs, their dosage, what they are, how they are used, and what they are used for, and or whatnot. So a brief introduction. As optometrists or as student optometrists, the mastery of ophthalmic drugs can be very vast and is helpful in the optometry practice. So it helps us to treat ocular conditions, and with this, having expert knowledge of drugs is very, very necessary in our clinical practice. So that is the essence of this class. Also, in optometry, the use of drugs should not be a difficult task, since most of the drugs are usually topical drugs. When I say topical drugs, I mean they are drugs, most of them are drugs applied on the eye. You understand? Topically, they apply on the eye topically. And their classes are usually common classes we know, ranging from the antibiotics, the corticosteroids, the antiviral drugs, the NSAIDs or analgesics, and the glaucoma drugs, example, the carbonic anhydrase inhibitors, beta blockers, and the rest of them. So while prescribing drugs, we should not forget our knowledge of pharmacology, because a number of factors are put in place to maximize the effects of drugs and the availability of drugs in the system. And with that, also minimizing the potential side effects. So some of these drug industry have put some things in place to maximize the effectiveness and availability of drugs, and also to minimize the potential side effects. So it's very important for you to have a knowledge of pharmacology when prescribing drugs. Because if you don't have the knowledge of pharmacology, you might overdose, and you can underdose. You understand? Underdosing a drug, you might see it as not a bad thing. It's a bad thing because, one, you'll be wasting money. Patient will be wasting money for that drugs. And two, the patient, because of you underdosing the drug and no improvement on the case, the patient might keep on taking that drugs and become resistant to that drugs. So that is why it's very important to have a good knowledge of pharmacology when prescribing drugs. So some factors that can affect the availability and effectiveness of drugs are the pH, the tonicity of the drugs, the stability of the drugs, the sterility of the drugs. And it's very much important to have these factors in mind. So I'll be explaining in details on the pH, the stability, and the sterility of the drugs. Hope you are getting me. Hope you are following.
Yes, Doc, we are following.
Okay. So in this lecture, we enumerate some useful pharmacological terms that most optometrists are not paying much attention to, and also they are not conversant with it. And my aim at the end of this part 1 lecture is to stimulate our interest in ophthalmic drug prescription. So now, talking on pH, what is pH? So pH, when we are in secondary school or in our A-level class, in our O-level class, we learned that pH is the acidity and alkalinity of drugs. So it's the same thing. So here in medicine or in drugs, in pharmacology, pH is the potential of hydrogen, or pH known as the potential of hydrogen is the logarithm scale used in measuring the acidity and basicity of an aqueous solution. So it's the same way you define pH as the measure of the acidity and alkalinity of a substance. It's the same way we define pH in pharmacology. So pH, the abbreviation pH means potential of hydrogen. So it's a logarithm scale used in measuring the acidity and basicity of an aqueous solution. So when I say aqueous solution, I mean um, a liquid form of drug. You understand? A liquid form of drug or a dissolved substance in water. So that is what I mean by aqueous solution. So a solid form of drug can become an aqueous solution when it gets to the system. It dissolves in the bloodstream and becomes an aqueous solution. So when I say aqueous solution, it's not limited to just eye drops or suspensions. So it can be in tabs too, because tabs can become an aqueous solution when it gets to the system. Hope we are still following.
Yes.
So now talking about pH, pH of a drug less than 7 is said to be acidic. Then pH of a drug greater than 7 is said to be alkalinic or an alkaline or base. So the pH of our tear film, you know our tear film, because I know I'm speaking to students from 200 level to final year and some doctors here. So when I say tear film, I'm talking about our tears. So our tears is made up of 3 layers, and these 3 layers is called the tear film. So the tear film has a pH level of 7.4, approximately 7.4. So any solution that is below 6.6 or above 7.8 in pH is said to be uncomfortable when instilled in the eye. Why? So the question here is why, and I'll give you the answer. The answer is because it is not conforming with the pH of the tear film. So the tear film, God created the tear film in a way that the pH will not react with the eyes or will not pose any form of pain or stinging effect to the eye. So if you're applying a drug and the drug pH is within the same pH with the tear film, you will not experience stinging effects. So that is why some drugs sting. Some drugs sting because the pH of that drug is not same with the pH of your tear film. So especially when the pH is far, far different from the pH of your tear film. When it's below 6.6 and 7.8, the stinging effect is very significant. And this question is a viva question. I know why I'm mentioning it. The reason I'm mentioning it is because it was my viva question in my 5th year. So I was asked by Dr. Jacqueline, my hands-on was to instill an eye drop. After instilling the eye drop, my follow-up question was, why does an eye drop sting? So I was asked to give 2 reasons. I was able to remember one reason, and which is this reason. And I didn't get my complete answer. I didn't have this knowledge, the knowledge of pH of drugs and pH of its film, and why when it is different it stinks. I would have failed that question entirely. So you see, that is why it's important. Everything I'm going to say here is very much important. So this diagram is a scale showing different substances and their pH level. And looking at it, you tell yourself that whenever any of these substances get into your eye, there are some that will sting and there are some that will not sting. So you see, the blood the human blood is on the pH level, is on the neutral level, or is on the same pH level with our tear film. And why is that gives us the reason why our tear film is the same pH with our blood, because the tear film is a filtrate of the blood. So the tear film is a filtrate of the blood. So it is, okay, Victor, if you're not seeing my slide, maybe it's your network. So the pH of the tear film is the same with the blood because the filtrate of the blood. So that is the neutral point, and it's close to 7. And when you go up, our seawater is about 8 pH. So that is why for those of us that swim, when you go into the swimming pool or a sea, and with your eyes open, you will notice the stinging effect of that water, because the pH of that water is acidic, is basic, sorry, is alkalinic, is higher than the pH of your tail fin. So you can see our lemon juice is acidic with a pH of about 2 and other substances. So try as much as possible to avoid the acidic solutions from getting into your eyes, because they are more they might corrode your cornea or other tissues of your eyes. Hope you are still following.
Yes.
So now, talking about buffers. What is buffers, or what are buffers? Buffers are chemicals added to a drug that help them to maintain a comfortable pH between 6 and 8. Buffers are chemical substances added to a drug formulation to help them maintain a comfortable pH between 6 and 8. So these buffers can be in form of preservatives. You might have heard that some drugs contain preservatives. Why do the preservatives, those preservatives are not just there to make the drug last long. It's also to provide a buffer for this drug. But some of the buffers might also increase in fact, the buffers affect the pH of these drugs. So it's either it's reducing the pH of the drug or it's increasing the pH of the drug. So depending on the buffer and the concentration of the buffer, this buffer determines the level in which the pH will be. So for it to be within the normal range of pH, there is a concentration of buffer be added to get the normal range of pH that will be comfortable for the eye. But at some point, some buffers can also keep the pH of this drug outside the normal limits, and this makes the drug sting. So now, talking about tonicity, I know why I'm explaining all this, because you can't just jump into learning about the different kinds of drugs and what they are used for without knowing the pharmacology of these drugs, without knowing the pharmacokinetics, the build up and the actions or the movements of these drugs, and how these drugs stability and availability functions. So talking about tonicity is the relative measure of the osmotic pressure inserted between two solutions. So tonicity is like the concentration. Are you with me? I don't know if my network is disturbing.
No, we are hearing you.
Okay. Okay. So tonicity is like the relative concentration of a solute in a solution compared of the solute in a solution compared to other solutions. Are you with me? So, for instance, I dissolve a salt particle in water, and I bring maybe a tuber of yam, and or maybe I bring a pawpaw a tuber of pawpaw, creating a hole inside that tuber of pawpaw, and I place it in that water in which I dissolve salt in it. So the tonicity of that medium is the concentration of that salt in that water. So that if that salt have a higher concentration than the concentration of the pawpaw, so it makes that water hypertonic. So if the concentration of the solutes in the water is higher than the cell placed in that water, that solution is hypertonic. So if the concentration of the cell is higher than that of the water, of the solution itself, that solution is said to be hypotonic. Hope you are following. Hello?
Doc, we are with
If you're
you.
following, tell me.
I can
I don't know
hear
when my
you.
network disrupts me because I'm not.
No, we can hear you. From here, it's clear. On my side, I can hear you.
Because
I can hear you.
okay, let me. I think I just to avoid. So let's go on. Like I was saying, when the solution is higher in concentration than the cell is hypertonic, then when the solution is lower in concentration than the cell is hypotonic. Then, but when the concentration is in the same, when the solution is in the same concentration with the cell, then it's said to be isotonic. So it's isotonicity means that that solution is in the same concentration with the cell. So some drugs have a tonicity. So this tonicity affects the availability of this drug in the body. So that's why I'm explaining this tonicity. So this tonicity brings about osmosis. We know that osmosis is a movement of a solution from the region of higher concentration to the region of lower concentration. So, and then what brings about what controls this movement is the osmotic pressure. So most ophthalmic drugs are designed to be isotonic with the human tears. So they are designed to be isotonic with the human tears. So some tonicity agents are called buffers. So they are usually added to the preparation of drugs to keep it within a particular range of pH. So example of these agents are glycerin, sodium chloride, which is a salt, potassium chloride, which is another salt too, and other kinds of salts. So these are buffers that are added to drugs to maintain the pH with to make it isotonic with the human tears. Now, talking about drug stability. So drug stability refers to the capacity of a drug substance to remain within established specification of identity, strength, quality, and purity. So drug stability means the ability of a drug to still retain its strength, its form. The identity means its form, its appearance, its quality, and purity over a period of time. So there is no drug that is indefinitely stable. There is no drug that is stable for a lifetime. So some drugs have a period of stability because definitely every drug degrades, and there are some factors or some things that affects drugs that causes the degradation of drugs. So it's important to also know this so that you know how to store your drugs. You know when a drug is not fit for dispensing. You know when a drug, even if it has not reached the expiring date, is already expired, because some drugs can expire before reaching the expiring date. So when a drug degrades, you don't need it to reach the expiring date before you discard it, because it's already done. And also this stability, knowing the stability of a drug and the factors that affects it, tells you when to advise a patient to discard a particular drugs. There are some drugs that the stability are stronger than the others. So glaucoma drugs are usually stable than other drugs. That is why glaucoma drugs can be administered for a month than other drugs like our anti-histaminic drug, our anti-allergic drugs, antibiotics that are given for 2 weeks. So the reason why most of these drugs are capped 2 weeks is because once the drug is open, once you open that drug, the degradation starts. So the stability of this drug begins to reduce over time. So the max for these drugs are usually 2 to 3 weeks that the strength and quality of this drug reduces. So, but the glaucoma drugs can remain stable for about a month or even a month and a week. So that is why glaucoma drugs are usually capped, can be given for a month, and it still retain its strength and quality. So pharmacological degradation is aided by light, moisture, heat, and other things. So I will explain that also in the next slide. So drugs that are slightly acidic tends to be more stable than the neutral or alkalinic preparations. So that is why some of the drugs that sting more, especially the acidic one, are more stable. So you can also agree with me that some of those drugs are usually, if you check our prostaglandins, they sting a lot. And because of its nature, it can also cause dry eye. So, and you can give this drug for about a month. So it's very stable than our antibiotics that most of them don't sting, that we can just give for 2 weeks because the stability is not that strong. Hope you are following. So these are the factors that affects drug stability. Number one is temperature. So if you read the leaflets of drugs, you see most of them, they say keep at room temperature or keep at a temperature not less than 30 degrees. You understand? So most of these drugs have a particular temperature for storage. So temperature can affect the stability of a drug. So when you keep outside the temperature that is required for this drug begins to lose its quality and strength. So light can affect some drugs, but not all drugs. There are some drugs that are usually stored in a brown container. We call it amber containers. There are some there are some containers that are brown, glassy brown. So that is called amber color. So there's a reason for that color of container, because amber color container absorbs light, so it stops light from reacting with this drug. So some of those drug stores in this kind of container, once they react with light, the stability is affected, so degradation starts. So light can degrade some drugs, and oxygen too can degrade. In fact, oxygen degrades almost all drugs. So once a drug is open, degradation starts immediately. So that is why when you open an eye drop, we said that you should discard the eye drop 2 weeks after usage, because once you open it, air gets into that eye drop and degradation starts immediately. So except the glaucoma drugs that are built in a way that is very much that is stable and it can last for a month, so you can use it for a month. So moisture can also affect the stability of drugs, especially tablets. When it gets in contact with water, the degradation starts, it degrades the drug. And some eye drops too. What that water can penetrate almost every substance. So, and water also can also affect the temperature of a drug. So that is why if you check the leaflets of some drugs, you see store in a dry environment. So so that it will not get in contact with water in order to avoid degradation. So the pH of a drug can also affect stability, like I told you. And there are some drugs that are made acidic. So when the pH is acidic, it makes it more stable than the alkalinic drugs. It makes it more stable than the alkalinic drugs that the pH is lesser. That the pH is higher, sorry. Think higher pH, higher the pH, the more basic it is. Then the lower the pH, the more acidic it is. Are we following? So the concentration of the drug also affects the stability. And the dosage and forms of the drug also affects the stability. So the concentration, like I said, like I was talking about, please mute your mic so that you will not disturb our lecture. If you come in, you mute your mic. Let's see, mute. Okay. So, like I was saying, concerning isotonic and hypertonic. So this is the tonicity as a result of the concentration also affects the stability of this drug. So, and that is all. So to note, drugs do not need to be refrigerated except stated in some drugs. So not all drugs are refrigerated. So there are some few drugs that needs to be refrigerated, like our prostaglandins for glaucoma drugs called prostaglandins, and like our Zalatan, our travoprost. Most of them are stored in the fridge because they need a lower temperature level to improve the stability, to keep it stable. So avoid storing drugs in direct sunlight because sunlight can affect most drugs. Once opened and exposed, solutions are degraded by oxygen. Medication should be stored in their opaque containers. So do not transfer drugs from one container to the other. There's a reason for that container. So now talking about sterility and preservatives. So once drug is opened and the solutions are exposed, these solutions are not only exposed to degradation, they are also exposed to microbial contaminations. So contaminations like Pseudomonas aeruginosa, Acantha amoeba, and some other bacteria. These bacteria can get into this drug and live into this drug. So that is why there are precautions taken when instilling eye drops. So when you open an eye drop, do not keep the cap on the table in order to avoid contaminating the cap. And when instilling the eye drop into the eye, avoid the tip of the eye drop of the container from touching the eyelash or the eyelid, because especially when you are treating a case of infection, because this eye is infected or this eye might be infected, and once you touch the tip of the cap on the lashes or the lids, you have picked up these microbial organisms and the drug becomes contaminated. So you can infect the eye while trying to treat the eye. So preservatives are added to drug preparation to control microbial growth. So this is another reason. This is another reason why um, um, preservatives are added to drugs, not only to control the preservatives like buffers, not only to control the pH, it's also to control microbial growth. So preservatives are of two types. We have the bacteriostatic and the bactericidal. So the bacteriostatics are those that stop the the proliferation of these drugs. So these preservatives do not make these microorganisms to multiply. So once the drug gets infected by one of these microorganisms, it remains one. So the microorganism cannot multiply into multiple cells. So it remains that one. So that's how this bacteriostatic preservative functions. While the bactericidal, what it does is once the microorganism gets into it, it kills the microorganisms. So an example of a bacteriostatic preservative is the thimerosal. So the thimerosal is one of the preservative. Then the benzalkonium chloride, which is one of the most common preservatives you usually say in drugs. Most all drugs contains benzalkonium chloride. It's a bactericidal preservative. So it kills these microorganism. So most times is usually this benzalkonium chloride is some kind of toxic because it can irritate the eye a lot. It's one of the things that makes most eye drops sting very well. This was the second reason that I failed to give during my viva. Why does eye drop sting? So this was the second reason I forgot. Because the eye drop contains preservatives such as benzalkonium chloride, and this benzalkonium chloride irritates the eyes and it stings a lot. So, but it enhances drug penetration and preserves the drug. So some other common preservatives are phenylmercuric nitrate or acetates, 0.002%, chlorhexidine acetate, 0.01%, benzalkonium chloride, 0.01%, like I said. And some newer preservatives are sodium perborates, purites, polyquantinum, and some others. So why do eye drops stink? I've already explained it. One is the preservative, benzalkonium chloride. Two are stabilizers like glycerin. Is also a buffer that is added to drug to regulate the pH or to improve the pH. Another is if the pH is not equal to the pH of the tears. So if it is equal to the pH of the tears, it won't stink, but if it is different, it will stink. So the pH of eye drops are usually 6.3, between 6.3 to 6.8 for effective delivery system and amount of stinging. So another reason why eye drops sting is tired eyes, dry eyes, and individual pain threshold. Tired eyes, I mean, it's when the eyes is stressed and strained enough, when you instill an eye drop in it, it stings. No matter how stinging, how low the stinging effect is, the patient will notice the stinging immediately or significantly. So when the eye is tired, the eye drop will sting. And also, people having dry eyes also always experience stinging effects from eye drops. So when you're having dry eye, you experience this stinging effect. And some people that have low pain threshold. So people that are very sensitive to pain, no matter how low the stinging effect is of that drug, they will feel it. So now talking about vehicles, when as I said vehicles, now people will be like, do we have vehicles in drugs? Do we have cars or bicycles in drugs or motorbikes in drugs? Yeah, vehicles are agents that provide support or that are used to dissolve active drugs. So they are inert. They are inert agents or non-active agents. So they are used to dissolve active drugs. So they have no therapeutic value. They are just like a placebo. So example of vehicles are buffers are buffers that are used to improve the pH of this drug. So these buffers are used to dissolve this drug in order to improve the pH. So they don't treat the eye. They have no therapeutic value. They are not they have no antibiotic value. They have no steroidal value. They have no antihistaminic value. They are just inert drugs. The only thing they can do is either they are preserving this drug, or they are increasing the pH level of this drug, or they are influencing the pH level of this drug. So example, they can function as a buffer. The buffer is one example of vehicles, and they also control the viscosity, that is the thickness of this solution. So most of them are used to dissolve this solution to make it watery or less solid, thick, that is less solid. Common examples of vehicles are povidone, PVB, polyvinyl, our carboxy methicellulose. This carboxy methicellulose is usually found in our artificial tears. So in our hypromellose drugs or artificial tears, you see this carboxy methicellulose. And some can be in form of gel, which is our example is our gerites. Usually find in this drug they call Ophthalmic. So they can be in our ophthalmic ointments too. Example is our white petrolatum and lanolin. I hope we are following.
Yes, sir.
Are you with me?
Yes, sir.
Yeah. So
Yes, Doc, we are here.
now talking about expiry date of drugs. Expiry means that drug cannot be used after this date because the concentration of this drug is decreased and is now lower than the therapeutic concentration. So when you see an expiring date of this drug, it means that no matter how best you store this drug on all the good or recommended mode of storage, even though you store it that way, as far as you have exceeded these dates, this drug is no longer good for use. It has degraded to the last point that it has no strength or no therapeutic concentration. So that is what expiring date means. So you see some people after expiring date will keep using the drug. The drug will not do anything. In fact, the drug becomes toxic after the expiring date because it's now lower than the therapeutic concentration. So it's no longer of value to the eyes. So, but some drugs can expire before the expiry date. So it doesn't mean that when you open the drug, because you've not reached the expiring dates, and you have already opened the drug, but the drug have not reached the expiring date, you keep using the drug till it reaches the expiring date. No, so most drugs, once you open them and they come in contact with oxygen and light and other things, it starts degrading. So most of them degrades, it takes them about 2 weeks or 3 to degrade, some 1 month. So when you exceed the required, that's why we instruct patients to not to exceed the required days for this drug. So if you prescribe for 2 weeks, this patient should discard this drug after 2 weeks. If you prescribe for a month, this patient should discard this drug after a month, regardless of the expiring date. So that expiring date is just for the storage. So it's just the dates for how long this drug can last in the required storage. So, like I said, in addition, some products of drug degradation are toxic and harmful to the patient. So when this drug expires, it has degraded enough. So it becomes toxic and harmful to patients. So note, after opening of drug container, the expiry date will be shorter as a result of the decreased concentration of drug during usage and effects of external factors. Those external factors I've mentioned before. So once those external factors begins to affect this drug after opening, the expiring date is now shortened. So expiring date can now become 2 weeks or a month. So example, eye drops can be used for 1 month after opening the droppers. Syrups and suspension of antibiotics can be used for 1 week by storage in room temperature, for 2 weeks by storage in 4 degrees Celsius. Tablets and capsules remain stable in the package, but after removal, the expiry dates will change. So when you remove a tablet from the package, the expiry date changes. So ampoules must be used immediately, but they are usually stable for 24 hours because of the presence of the preservatives. So ampoules are drugs that usually, once opened, should be used immediately and can only last for 24 hours. So now, drug administration. What are the different routes of drug administration? When I say drug administration, I'm talking about ophthalmic drugs. So we are talking about ocular pharmacology. So I'm talking about ocular drugs. So we have the topical routes, which can be in form of solutions, which are eye drops. Most of our eye drops are solutions. Suspensions, some eye drops too are suspensions, and can be in form of ointments and also gels. Some topical drugs are also spray. So solutions are usually active drugs dissolved in a liquid medium. So the drug substance is dissolved in a liquid medium. For suspension, it's a drug. The drug is not dissolved in the liquid medium, but it is finely divided in that medium. So that is why in suspensions, you can feel, after applying it on the eye, you can feel some form of sanding sensation because of the substance didn't dissolve or is not dissolved into that liquid medium. So this is the difference between a solution and a suspension. So categories of drugs, we have the systemic, which is oral or injection, can be in form of injection. We have the eye drops, we have the ointments, we have the solution and suspensions. We have drugs in contact lenses and collagen shields. So we also interest you to know that drugs can be administered in contact lenses. So some contact lenses are manufactured in a way that drugs are built in it. So for therapeutic purpose. So the contact lens are worn for therapeutic purpose, not just to correct refractive error. Especially for cases of cornea um, problems, cornea ulcers, cornea problems. So we have sprays. Now, talking on the classification of drugs, we have the anesthetics. Most of the anesthetics are diagnostic drugs. Example is our Primax, our proparacaine we use for tonometry, our contact tonometries. And some examples of anesthetics are lidocaine, xylocaine, prosimetacaine, and the rest of them. In fact, so prosimetacaine is something as proparacaine. So these are anesthetics. So another classification is antihistamines, so which are anti-allergic drugs. So it can be, example is loratadine, our antalarge, our tetralarge eye drops. So they are antihistamine drugs. We have the anti-infectives, which can also be called our antibiotics. So it can be in form of eye drops and tablets. So we have the antifungal drugs. It's also can be in form of tablets and eye drop. We have the antiviral, can be in form of tablet and eye drop. Example of antiviral is acyclovir, aciclovir, and all the ver. So they're usually antivirals. So we have the artificial tears or ocular lubricants. So this ocular lubricant reminds me of my board exam. I was asked, I was given a drug, IV Moisel, and I was asked, what class of drug is this? And the classifications keep my memory. The only thing I could mention is artificial tears, and they told me no, that's not the name they are looking for. That there's another name, the main name for that classification, and I couldn't remember any other thing till I left the hall. When I left the hall, I remember ocular lubricant. So the name for that classification is ocular lubricant. So experience is a better teacher. So we have the anti-glaucoma drugs, which are the beta blockers. How many are we in the meeting? Okay. We have the beta blockers. We have the carbonic anhydrase inhibitors. We have the prostaglandin agonists. We have the cholinergics. So the beta blockers, example of the beta blockers is timolol. The common timolol we usually know, timolol, betazolol, or the lololol, propanolol, all those drugs that ends with law. That's one of the fun. This is the most interesting thing in pharmacology. Pharmacology is easy, but it's vast, but it's easy because most of these drugs, they are named in a way that they usually end the same way, or they usually start the same way. So their surface is usually same. So when you hear timolol, betazolol, so you know that they are in the same classification of drugs. They are beta blockers. So when you hear for antibiotics, when you hear gentamicin, tobramycin, ciprofloxacin, uh, moxifloxacin, all the sin, all of them are antibiotics. And when you now begin to hear Floxas, ciprofloxacin, moxifloxacin, all the floxas are usually the fluoroquinolones. They contain the same family of fluoroquinolones. So you know that is among the family of ciprofloxacin, then moxifloxacin, all of them are fluoroquinolones. So these drugs have similarity in names. So it is very easy to master them. So pharmacology is easy because it has been structured in a way that makes it easy, but it is vast. So you don't feel it is difficult to learn. It is not difficult to learn. It's very, very easy. Very, very, it has been made in a way that it's easy. So even as we advance in the practice, more things will be brought on board that will bring more things on board that we change how we learn most of these drugs. In fact, now most drugs are now capped with a particular color. Though it's not common now in Nigeria, but in some part of other countries, the drugs, anti-glaucoma drugs, beta blockers have a particular color of cap. So when you see a drug with this color of cap, this is a beta blocker. When you see another color of cap, anti-allergic drug. So it now makes things easier. It's easier identification of drugs. So please just be very enthusiastic about it. So we have the corticosteroid, we have the cycloplegic. Corticosteroids can also be called as steroids. So they are anti-inflammatory drugs. So example of our corticosteroids are those drugs that ends with O-N-E, on. Our betamethasone, our dexamethasone, our prednisolone, our all the on of the owns. So they are corticosteroids. So you see how interesting it is, right? So the cycloplegics or midratics are drugs. Most of them are. It can also be a therapeutic and also a diagnostic drugs. Example is the atropine. Atropine is both midratic and therapeutic. It's used to treat uveitis, and it's also used to dilate the eyeball for internal examination, for fundoscopy, and it's also used to knock off accommodation for cycloplegic refractions. So we have the immunomodulators, we have the mast cell stabilizers, which is an example of our decongestants, and is an example of our anti-allergic drugs. So they inhibit mast cell. So they stabilize this mast cell. because most of how this allergic response occur is once the allergen comes in contact with the body, it triggers the formation of mast cells. Sorry, these mast cells are released from the body, and this mast cell now bursts and release the histamines. So this histamines is what triggers itching of the eyes or of the body. So most of these people that have itching as a response to allergies, this is how it happens. So some of the drugs we give for allergy mast cell stabilizer. So this drug stabilizes the mast cell and prevents it from bursting to release the histamines. So the itching reduces. So example of our mast cell stabilizer is, for example, one drug that have the mast cell stabilizer is our ketotifen. So our ketotifen is a triple action. It has the mast cell stabilizer, it has the decongestant, and take the antihistamine in it too. So we have the non-steroidal, our NSAIDs. Example is our ketorolac or our diclofenac eye drops or our nepafenac eye drops. All the NAC, ketorolac, all the AC drugs are non-steroidal. So ketorolac, diclofenac, and nepafenac, aceclofenac, all of them are non-steroidal. So you see how interesting the name sounds, right? So we have the ocular decongestants or vasoconstrictors. Those are also a classification, because what this drug does is to clear redness of the eyes. So a redness, most of the redness are a result of allergic conjunctivitis or um, inflammation. So what the drug does is to constricts the blood vessels, because the reason why the eyes is red is because of the blood vessels on the eyes are not swollen. So they are now dilated. So that contributes to the redness. So the decongestants or vasoconstrictors, what they do is to constrict these blood vessels. By constricting the blood vessels, the redness reduces. So example of a vasoconstrictor, a decongestant is our I think our tetrahydrozoline. Yeah, yeah. Okay, so tetrahydrozoline is a decongestant. It's contained in most drugs like tetralarge. You see it in tetralarge or antalarge. You can also see it. Okay, you can make you can do an assignment for that. So our sympathomimetic drugs, parasympathomimetics. I don't want to spend more time in explaining these drugs. So let's move down to the clinical administration. Key points in clinical administration. So a general understanding of drug nomenclature, pharmacology, and prescription writing can help avoid undesirable complications of drug. So a general understanding in naming of drugs or the names of drugs, the pharmacological effects of these drugs, and the prescription writing of these drugs, how to write these drugs or the dosage of these drugs, can help you avoid undesirable complications of drug administration and interaction. It can also reduce the side effects of these drugs. So a comprehensive medical history must be taken on all patients, including the and allergies to drugs. So when prescribing drugs, you need to do a vast case history on this patient, after finding out the signs and symptoms and duration and all the go in case history, find out about their drugs, the drugs they are taking in the past, and the drugs they are currently taking, and if they're allergic to any drugs at all, because most of the drug that you might be prescribing they might be reacting to it. So you will not want to prescribe that drug. So you want to choose any other kind of drugs for them. So because if you go on in prescribing drugs they're allergic to without finding out, this patient will not take this drug. After taking the drug the first time and react to that drug, will stop taking the drug. So it also contributes to compliance of drugs. So all tests performed and drugs administered have the potential to alter subsequent tests. So choose order of your examination wisely. So the reason why I'm saying this is the way our test plan and our drugs and the drugs administered during the diagnosis of a patient or during our diagnostic test, it is structured in a way that the first test will not affect the result of the second test, and the drugs used to perform that test will not affect the results of the other test. So when doing your tests, when structuring your test plan, follow the right procedure. So what I'm trying to say is you shouldn't do dilated fundoscopy first before refraction. You shouldn't do dilated unless you want to do a cycloplegic refraction, because when you dilate, you've affected the VA. The VA becomes affected, and also when you do fundoscopy, you have bleached the eye. So the VA is also affected. So you have to wait for the patient to rest for some time or for the dilation to resolve before doing subjective refraction. In order to avoid this wait, you need to do those things, those tests that will not affect the other. So do them first while you do others. So it's very important. That is a key point to note. So now talking about drug nomenclature. So to avoid mishap, all pharmaceuticals must be properly identified. All drugs must be properly identified. To identify all drugs, the name, the contents, the active ingredients of that drug, because misidentification of this drug could result in inadvertent administration and inadvertent administration of the wrong drug. So if you don't know the name of this drug or the content of this drug, you prescribe the wrong drug. So before administering any drug, make a conscious effort to read the label of every product. So read the drug to find out content, the name and everything, and also the dosage. Especially if you don't know, if you are not conversant with that drug, if it's your first time knowing about that drug, you need to study it first before administering. So for ease in drug identification, there has been an attempt to color code the caps of various drugs based on the classes to which they belong. So like I said, now some drugs are now produced in a way that the color caps have codes. The caps have color codes, sorry. So in order to identify their classes. So midratics and cycloplegics now have red caps, but you might not see them in this part of our country. Though some of them that might have been shipped from outside, you might see them, but they are not common yet here. But there are drugs like that. So midratics and cycloplegics are now having red caps. Our beta blockers having yellow or blue caps. Our myotics having green caps. Our NSAIDs having gray caps. Our antibiotics now having brown caps. However, this color scheme has not been universally adopted and implemented. So it's always some countries are just starting it because it's not universally adopted and implemented. So remember, there is no substitute for reading label. So even if the drug has a particular color code, it's still important to read label. So it's not a substitute for you not to read a label. So read the label so that you know the contents and other things. So always check for expiry dates and the coloration of the solution if it can be viewed. What I usually do sometimes, before I still an eye drop on the patient, I drop some on the floor to see the color of that eye drop, so that I will know if this drug has been degraded before now, so that I won't administer a degraded or expired drug. So now talking about drug compliance, are we tired or are we still agile for this class?
You are still agile, right then, sir?
Okay. So going on, patient compliance is key to proper therapy. In fact, one of the important things in drug administration is compliance. If this patient do not comply with the drug administration, you're not going to get any results. The treatment will not go, and you won't get any therapeutic uh, effects. You will not get anything. The patient will remain that way. So drug compliance is very much important
No, we're
in
not tired. They are
pharmacology.
agile.
So why is drug compliance difficult? One is, why do we usually have non-compliance in drugs? One is apprehension. Most patients find it difficult to understand the directives from the doctor. So in order to improve compliance, explain in a lower terms, in a terms in which the patient will understand. So most of us will want to exercise our doctor's ability in prescribing drugs. They are prescribing drugs for a patient. They are writing the prescription for this patient. You write it in a prescription writing way in which only doctors can interpret, and you write it for this patient and give to this patient without explaining to this patient. You want the patient to do magic and understand how to take this drug. You will not get the required drug compliance for this drug. So when prescribing drugs, when giving this patient this drug, explain to this patient and write the dosage or the directive for this drug in a way this patient can understand, in a way anybody can understand, so that this patient will comply, will give you the required compliance for this drug. Another thing is lack of dexterity. Um, some doctors might not be proper uh, uh, properly informed on how to prescribe drugs. So if you lack dexterity in drug prescription, this will influence the compliance of drugs by this patient, because you will not um, um, give the better directive. This dexterity also have something to do with apprehension, because if you don't know how to explain to a patient uh, on the directives of to administer the drug or to take the drug, you can't help the patient understand. So lack of dexterity also is a prerequisite to apprehension, to the patient understanding the directives. So confusion is also another thing over instruction. Most of these patients might be confused. You tell them 3 times daily. They might be confused 3 times daily. Is it 3 times in the morning, or 3 times in the night, or only 3 times in the afternoon? So you explain to them, when I say 3 times daily, I mean morning, afternoon, and night. Or when I say 3 times daily, I mean every 4 hours, every 6 hours, or if I say 4 times daily, every 4 hours. So you explain to them in order for them not to be confused, because most of them might misinterpret your directive. So confusion of over instructions. So you should be very, very much um, careful about that. So another thing is forgetfulness. Most of these patients can forget. So it's another duty for you to write it down, either on the paper of the drug, the pack of the drug, or you write on the paper and put it inside the drug container, or you use a paper tape, and wrap on the drug and write the drug. So write the dosage or the direction for this drug somewhere, so that once this patient forgets, there's something to remind this patient. So most patients usually forget. So expense, how the cost of these drugs also affects compliance. So if it's a drug that a patient needs to buy every month, especially the glaucoma drugs, most of them are usually expensive, especially the prostaglandins. Most of the prostaglandin, one of the bottle is about 14,000 naira. Some are 7,000 naira, some are 10. So imagine you are telling this patient to buy every month. If you happen to be a patient that don't have the money, it will affect the compliance. This patient will just take for the first month and stop taking this drug because of no money to get this drug. So another thing is faith. Some people faith or church believes that they are not supposed to take drug. God will heal them of their sickness or whatever they are passing through. Yes, I also believe in miracle. God will heal you. In fact, miracle is a good thing. Every Christian believes in miracle. I am a Christian, I believe in miracle. But also God helps those who help themselves. You get. In fact, the way God wants to heal you is by providing you with doctors. So God has provided you with doctors to help heal you. God is not going to come down to heal you. There is no uh, 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 there is no way you will see God will knock on your door and say, "My son, take Timolol, apply in your eye, and you'll be healed." No, it's through a doctor. God will direct you to the right doctor, and the doctor will give you treatments that will heal you. And through prayers and faith, you get healed. Especially through good compliance with the drugs, you'll be healed of that sickness. So, but some people's faith have already affected their compliance. So they'll be like, after prescribing the drug, they'll be like, I'm not taking this drug. I'll pray. I believe. Or my church says we shouldn't um, take so drugs. We shouldn't take drugs. Because I know some faiths that abolishes them from doing blood transfusion. No matter the kind of sickness or the illness you have, they will advise you not to. If you need blood donation, they will advise you not to undergo blood transfusion. It's rather you should die and go to heaven. That is bad. So the next is medications. Medications may not be put in. Medication may not be put in often enough. So there are some patients. How do I explain this now? The patients you tell them that, especially for when you are trying to treat a severe bacterial conjunctivitis, you tell this patient, please apply this drug every 2 hours or every 1 hour for the first day. This patient will forget. Most of the patients will forget. They apply the first 1 hour, apply the second 1 hour, when they remember again is in the night. So, so the number of times that you prescribe a drug can also affect the compliance. So we try as much as possible um, when you look at the work schedule of this patient, you should arrange the dosage according to the work schedule. If you know this person, you will always be busy. You not tell the person, I do it 3 times daily, rather than doing it every 2 hours, but do it 3 times daily. That means you will not take this drug for a longer time. Or you can now decide to also do both topical and systemic treatment in order to give, in order to increase the effectivity of your treatment. So that is what the seventh point is talking about. Hope we are following. Did I write on?
Yes.
Yes, yes, yes.
So
Yes.
another point. So another point here is medication used too often in hopes of getting a greater effect. Some people, you will tell them use it 3 times daily, but because of the way their eye is red, they don't like this redness. They'll use it. They'll go and use it 7 times in a day. That is a bad compliance. So they will overdose themselves. So it's very important for you to instruct this patient. Please, I say 3 times daily, and please, it should be 3 times daily. On no on no on no account should you administer more than 3 times, because if you overdose yourself, this is what will happen. This is what will happen. So you need to inform this patient that there is no need for instilling it more than 3. There is no need for instilling more than 1 drop. There is no need for instilling more than 3 times daily, as I've instructed. So 3 times daily is enough. 1 drop is enough. So don't overdose. So another compliance, I think it. Hello, are you all still with me? A call just came in and disrupted the. So medications may not be stored properly or may not be shaken. So what I usually do before instilling an eye drop, especially my diagnostic drug, I shake. Yes, most of these drugs might contain suspensions or the constituents of that drug might have segmented down to the bottom of the bottle. So you need to shake properly before usage. So, and also instruct these patients how to store this drug or where to store this drug and where not to store this drug to avoid degradation. So when more than one medication is thrown into the mix or multiple conditions are being treated concurrently, non-compliance comes in. So especially when you are treating more than one condition with a lot of drugs, most of these patients that you treat with this kind of plan, they usually don't comply. So you might decide what you want to do is to reduce the number of drugs, and maybe you try to treat one condition first before the other if you want to get full compliance. So proper education provided by the eye care staff will greatly improve compliance. So this education will directly impact to a successful treatment and patient satisfaction. So therefore, every effort must be made to reduce the reasons for non-compliance. Now, RX. What's the meaning of RX? When we see RX, it means prescription or it means take. So RS means take. So prescription writing. Now we move into prescription writing. So understanding prescription writing and prescription abbreviations. So now the first, ad lib. Ad lib means as needed or freely or as at when needed. So when you are writing, when you see a prescription that they wrote ad lib in it, it means this patient should take it freely or as needed. As long as the patient likes it, the patient takes it. If the patient let the patient take it 4 times in a day or 5 times in a day or whenever the patient feels the need to take it. Most of the drugs that are as prescribed like this are usually our artificial tears. So artificial tears are usually prescribed ad lib. So ad lib, you tell the patient whenever you feel the sandy sensation, you can just apply it, or you can decide to do it 5 times, apply it 5 times daily or 4 times daily, or your choice as you need, as you please, depending on the discomfort you are having or whenever you're having that discomfort. So just apply. So PRN means it's also the same thing as needed. So Q means every. So when you see Q, either QD means every day, Q means every, Q. So whenever you see Q, it starts to mean every. So QD every day, Q3H every 3 hours. So it means this patient should take this drug every 3 hours. BID or BDS means twice daily or twice a day. Q4H means every 4 hours. TID means 3 times daily, or TDS means 3 times daily. QID means 4 times daily, or 4 times a day. QOD means every other day. TIW means 3 times a week. 1/7. 1/7 means once daily. 7 means 7 days in a week. So 7 means 7 days. So when you see 1/7, now it's one day. This drug should be taken just for 1 day. Just for 1 day. Then 1/52. 52 means week because there are 52 weeks in a year. You understand? 52 weeks in a year. So 1/52 means this drug should be taken just for 1 week. So 1/12, 12 there means 12 months in a year. So 1/12 means this drug should just be taken for 1 month. So 1 day, 1 week, 1 month. So AC means adcibium. So adcibium means before meals. So HS, NOS, NOCT or cure HS. HS means at night. NOCT means at night. HS means every night. QHS, sorry, means every night. So the Q is every day. So either at bedtime or at night. So whenever you see this abbreviation in a prescription, it means this drug should be taken only at night or every night. So PC means post-sebum, means after meal. INT means between meals. So it means after, maybe in the morning, for you to take it in the morning, maybe you start eating your food. When you are halfway through your food, you take the drug, then you continue your and you finish up your food. So PM means in the evening. Then CC or cum means with food. So CCCF or cum means you should take this drug with food. So DAW means dispense as written. So these abbreviations, you always see them in one prescription or the other. So you should take note of what it means. So when you see caps means capsules. So it means this drug is a capsule. When you see GTT, it means this drug is an eye drop or drops. So especially when you see one cap, so I means 1, 2, 3, number of doses. So when you see I cap, means 1 cap. When you see IGTT, it means 1 drop of the eye drop. When you see so that is it. So mg means milligram, ml milliliters, ss 1/2. We are talking about tablets. So taps means tablets. TBSP means tablespoon, which is tablespoon is usually 15 ml for a tablespoon. Then TSP means teaspoon, usually 5 ml. So another abbreviations we will see in prescription is OD, right eye, OS, left eye, OU, both eye. So OD, oculus dexter, OS, oculus sinister, OU, oculus utac, which is both eyes, AD, right ear, AL, left ear. It's very important. You might be asking, why are we talking about ear? Yes, there are some drugs that are ENT drugs that are for both ear, nose, and so you should, especially when you're trying to interpret a prescription for somebody that was given a drug for the ear. So you're also a doctor, so you need to be versatile. C or W means with, S or WO without. So now these are abbreviations for routes of administration. So when you see TOP means apply topically, PR means by rectum through the ass. PO means by mouth or orally, or by OS means orally or by mouth. Then start means immediately. So there are some drugs, especially the injection, because we don't administer injection, but you can write prescription on injection for the patient to go to visit a nurse or to get this injection and give a nurse to administer. So you write means this drug should be administered immediately. So when you say start, it means immediately. So ID means intradermal. This drug should be, especially for injections, it should be administered on the skin. Then IM means intramuscular. ING means injection. IP interperitoneal, IV, intravenous, and then SL sublingual. So SL means sublingual, that is under the tongue. Most of the tablets are usually sublingual. So most of these drugs that are given sublingual, why do they give drugs sublingual? You said that sublingual, apart from intravenous, sublingual is another fast route of drug administration. Why? Because under the tongue, there are a lot of capillaries and blood capillaries there. So these vast or bundles or supplies of capillaries helps deliver or helps absorb this drug faster and deliver it to the bloodstream immediately. So apart from intravenous routes, sublingual is another fastest route for drug administration. So GOTS, eye drop, Ocul or UNG, we're talking about ointment. So when you see Ocul or UNG, chloramphenicol, it means chloramphenicol or ointment. When you see TAP ciprofloxacin, it means tablets, ciprofloxacin tablets. When you see LIQ, LIQ means solution. When you see LOT, it means lotion. When you see Nebul, it means a spray. When you see POV, it means a powder. When you see SYR, it means syrup. SUPP, suppository drug. SUSP means suspension. So are we following? Are you with me? If you are with me, react. Okay. Hope you are not tired though.
Write down some.
So of abbreviations. So take notes. Abbreviation varies between professionals. So you should use the one that is common. So in order not to confuse your fellow doctor, use the most common one. That is why when you are seeing those abbreviations, there are about 3 or 2 of them. So you can decide to put 3 of them in slash. If you write Ocul slash OUNG, maybe this doctor don't know that oculenta is ointment. The doctor will know that UNG is ointment on gentum. So UNG is on gentum, Ocul is oculenta. So abbreviations that are ambiguous are not recommended and should be avoided. So the ambiguous one don't recommend, so that you will not confuse the pharmacist or the dispensary. So all abbreviations carry an increased risk for confusion and misinterpretation and should be used cautiously. So don't confuse your pharmacist or your dispensary. So prescription writing. So written prescription have 4 major parts. The first part is the patient's doctor information, which have to do with the name of the patient and name of the doctor, address of the patient, date of birth of the patient, age of the patient. And the inscription is the second part, which is the name of the drug and the concentration of the drug. The concentration, I mean, is either in, if it's as an eye drop, is either in percentage, 50%, 50%, 0.5% or 0.1% or 1%, depending on the drug. Some eye drops are in 0.5%, some are in 1%, some are in 0.5%. So in tablets, is either in milligram or in IU. So depending. So that is concentration. Then dosage is how many times in a day. So that is the subscription. So subscription is talking about the dosage. Then the instruction is talking about the routes. The instruction is talking about the routes and number of drops or tabs. So maybe it's by mouth or by rectum or how frequent, the purpose, how many times to refill, if it's to refill every month for 4 months. And also, you can also include the contraindications for these drugs so that this patient will be mindful of it. And also, if you want this drug to be taken with food, or if you want the patient to avoid any drugs that can counteract the action of this drug. So you can put it in the instruction. So these are the 4 major parts of drug prescription: the doctor, patient doctor information, the inscription, the subscription, and the instruction. So a prescription should include name, address, and age of this patient. It should include the telephone of the patient, the number of the patient, and also the number of the prescriber. So you, the doctor, should include your number so that if the patient wants to call to ask questions based on confusion, the patient can reach out. You understand? So the next is the dates of when the drug was prescribed, so that you can use the track record of the expiry of this dosage. So that this patient will remember when he or she started taking this drug, or when this drug was prescribed, and when he or she is supposed to stop. But most of them might forget when they start taking it, and they will not know when is it 2 weeks. So from the dates, you can calculate when is it 2 weeks. So the date is important. So the generic name of the drug is very important. It's a bad practice to write the brand name, especially if you want to prescribe drug. And that is most doctors will prescribe you can prescribe Ciprotab eye drop. Ciprotab eye drop is not the name of is not the right way to prescribe drug. The generic name of Ciprotab is ciprofloxacin. So instead you write tab ciprofloxacin. Then you cannot put in bracket if you want this patient to get that Ciprotab gone. If you want to be specific on that Ciprotab, then you can put in bracket Ciprotab. This patient, please look for Ciprotab. Unless if you don't see Ciprotab, then you look for any ciprofloxacin. So it's very important to put generic names. Like if in case this patient cannot find that brand, the patient can look for any other brand that contains that drug of choice. So it's very important to prescribe with a generic name rather than a brand name. Another thing is to write the strength of the drug. So is either the drug is in percentage, 5%, 0.5%, 1%, or in mg, milligram, or 10 milligrams, or 100 milligrams, or 1000 milligrams, or in IUs, especially for the vitamins, 1000 IU or 2000 IU. So another thing is signature or initials of the prescriber. So you sign or you write your initial as a doctor. So example, sorry, I'm going to skip these slides. These slides, I was supposed to remove it from my slide. It's supposed to be in part 2. So let me just keep okay, now final prescription writing. So example number 1, you see got gentamicin. See, gentamicin is a generic name, but we have brands like Gentalab. So Gentalab is a brand name. So it's bad for you to write got Gentalab. No. So you see got here is a drop. Then this is generic name gentamicin. Then this 2GTT means 2 drops. Then times Q2H means every 2 hours. Then times 1/52 means for 1 week. So this means gentamicin eye drop, 2 drops every 2 hours for 1 week. Very simple, isn't it? Is it simple or not?
It's simple, it's simple.
So now the next one is ocul. Like I told you, ocul means oculenta for ointment. So you see ocul ointment, it means tobramycin ointment. At night, noct means night, at night or at bedtime. For how many days? For 2 days. 2/7. 7 means days. So for 2 days. So now I want somebody to answer this one for me. The third one. So someone should interpret this third one. So I know you are following, no?
These tablets read
Go on.
5 milligram. The tablets read 5 milligram one times twice a day every month, 1 month.
Okay, you tried. At least you are conversant with the abbreviation.
Okay, sorry,
But this means
sorry.
this pregnant.
This tablet 5 milligram, one dose twice a day for 1 month.
Good, good. So it means tab prednisolone, 5 milligram of prednisolone tab. Then I means one tab. So you relate it with the tab. I means one tab, one tablet of 5 milligram prednisolone, 2 times daily for 1 month. Yes. So that is what it means. So apart from Victor, another person should interpret this. No other person. Emiri, oh yeah, answer. Chemiri, are you with me?
Yes, I'm with you, Dr. Franklin.
Answer the fourth one. Good. Somebody just answered lotion, Optrex, sorry, taken as needed. Exactly. So it means Optrex lotion taken as needed. Exactly. Correct. Thank you. Amechi Chisum. It shows that you all are following. You guys will be good doctors. You'll be very good in prescribing and then transcribing drug prescription. That's nice. That's nice. That's nice. At least if you not learn one thing today, you've learned how to transcribe drugs. You use it and go and do Yanga. Yeah. You can even use that was one thing we usually do when we are in school. If we want to communicate with other persons in the faculty, especially those that are not conversant with drugs prescription, especially those departments that don't prescribe drug or things that are not good in pharmacology. We use drug prescription terms. I will want to tell you, I'll be like, I beg, these biscuits, give me one got, BDS. So there's a way we do communicate. When we use these terms, we use to intimidate our people from other departments. Or if we want to write something and pass to another person so that the other person will not understand, we write it in prescription form. So if you begin to practice it this way, there is no prescription you will see that you will not be conversant with. Even these prescription abbreviations, we also use it in diagnosis. We also use it in writing case notes. You will see some case notes that you see this patient complained of itching, and you see times 1/52. That itching times 1/52 means this patient has been complaining of itching for the past 1 week. So you see, this prescription abbreviation is not just for prescribing drugs. We're also using the writing case notes, so it's very important you are conversant with them. So now, key points. In addition to the drug penetration has added ingredients to control pH. The drug preparation has also controlled the pH, the tonicity, the viscosity, and microbial contamination. This is just a summary of what we've discussed from the beginning. So another point is drug breakdown occurs as a result of extreme temperature, exposure to moisture, and light. So store drug to avoid these factors in order to avoid degradation. Another point is preservatives are used to control microbial contamination. So they can, however, cause corneal toxicity, especially the bactericidals in some patients. So they can cause corneal toxicity, especially the benzalkonium chloride. So anterior segment conditions are normally treated topically. So anterior segment conditions like conjunctivitis, blepharitis, allergic conjunctivitis, bacterial conjunctivitis. So those are anterior segment conditions. Keratitis, those ones are the outer tissues of the eyes. They are normally treated topically. While those on the retina problems are treated systemically or intravitreally or retrobulbally. So you will need this drug to reach the back of the eye. So you need to take it through injection or through tablets. So that's why we prescribe antioxidants to treat macular degenerations and other retinal diseases. So antioxidants are usually tablets. So now drug application, how to instill eye drop. So to instill eye drop, first step is to tilt the head back and tell the patient to look at the ceiling. The second is to gently pull down the eyelid, lower eyelid, away from the eyeball. So just draw it down. Then you instill one drop into the fornix, into the sac of the lower eyelid. So instill one drop and then gently close the eyelid and ask the patient to close the eyes for 1 minute. So within 1 minute, the eye is enough for the eyes to absorb these drugs. So to instill ointments, you gently grab the lower lid also and pull it down and away from the eyeball. You apply a small amount of the ointment, about 1/4 of, the ointment is just like a paste, like a toothpaste. So the same way you press your toothpaste or your toothbrush, just press a little amount in the fornix of the lower sac and then gently ask the patient to close the eyes. So usually ointment are usually given at night. But in severe cases of bacterial conjunctivitis, you can start to do it twice a day. The reason why it's given at night is because ointment usually blurs the vision. So it can affect your VA. So vision might look blurry. So if it's somebody that needs much of the vision during the day, it's not advisable to instill ointment during the day. So what patients needs to know, you can always advise a patient that please always check the label and expiration date of medications before use. So in case we are going to get the drugs outside without you dispensing, so you tell them please check the label and expiration of this medication before use and do not apply more than one drug because it's just be you wasting the drugs, because applying more than one drug in the eye during single application gives no additional benefit. So it's just a waste, and drugs can be costly. So allow a minimum of 5 minutes before applying another eye drop. Maybe if you prescribe about two or more eye drops. So these patients, while applying these eye drops, maybe applying it in the morning, he or she should give 5 minutes gap between these two eye drops. So after applying the first eye drop, she wait for the next 5 minutes before applying the second eye drop. So they should always use ointment or gels at night because it can blur vision. So store eye drops under room temperature and do not refrigerate except instructed by a doctor, especially for drugs that needs to be refrigerated. So do not use more than 2 weeks after opening because of degradation, except for drugs that are prescribed for a month. So keep drops and ointments at room temperature unless instructed otherwise. Pockets and cars tends to have elevated temperatures, so this can alter the drug effectiveness. So this can degrade your drug. So don't put your drugs in your car or in your pockets or inside a box or anything that can increase the temperature. So and also extreme cold temperature can also degrade a drug. So that's why it's good to store in a normal room temperature or temperature within 30 degrees Celsius. To preserve sterility, do not touch the dropper tip of your eye drop on your eyelashes or the patient's lashes or the patient's fingers or eyelids to avoid contamination. Do not set the cap on the countertop. So do not drop the cap on the table, but the table might be contaminated with dust and other microorganisms and it can affect the eye drop. So when a suspension is prescribed, shake the bottle very well before using. So home care instructions for eye drops and eye ointment. So always wash your hands with soap and water before applying. In fact, these steps now, these things I'm going to explain now is very important in Viva, especially if you are giving a hands-on to apply eye drop. Those steps for instilling eye drop, you should know them, and also these home care instructions before instilling eye drop, you should observe them. So if they ask to instill an eye drop in Viva, tell them, sir, I want to go and wash my hand. They will not tell you, okay, don't worry, assuming you've washed your hand. So what next should you do? So you ask the patient to look towards the ceiling, open the both eyes, pull down the lower eyelid, steady, put the medicine. So pa 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 pa. I think I've explained all these. Okay. So now this is your assignment. So I'm going to drop all these questions. So write a prescription for each of the following patients. So you have to screenshot it. So this is case number 1. So I'll be expecting your submission by, today is Monday, so by Wednesday. So between Monday to Wednesday, everyone in the group chat should submit this assignment. So this is a case 1. These are the drugs prescribed. So write these drugs in prescription writing. So this is case 2, you screenshot. So write these drugs in prescription writing. Then this is case 3. This is a case and the drugs. Write it in prescription writing. So screenshots. So the screenshot, someone should send it to the group chat at the end of the class so that others will have it. So this is case 4. So this is case 4. So write these drugs in prescription writing. So this is case 5. So write this drug in prescription writing. So now these are 3 things to think about. The practice is yours. As an optometrist, your practice is your practice. It's nobody's practice. Whatever you do in your clinic, whatever you do, it's your practice. It's your professionalism. It's yours. So whatever you do it best. So give your best practice. Give the best to your patient. The patient is also yours. It's not another patient, another doctor's patient. It's not your neighbor's patient. It's not the family member's patient. It's your patient. So do whatever you can with your patient. So the patient is yours, and the prescription is yours too. So I usually call this the PPP is mine. So the practice is mine, patient is mine, and the prescriptions are mine to write. So whatever you do with them, make the prescription decision yours too. So that's the end of part 1. Thank you all for listening and active participation. So I'll be taking questions now. Either you drop it in the chat box or you raise your hand so that I can take the questions.
Please, if you have any question, I pinned it in the chat box. Drop it there, and so Dr. Franklin can clarify you on any question.
Good evening, Dr. Duru. Thank you for the class. If I could remember very well, I saw where you talked about recti something. Is it in the root of administration? Recti. I want you to throw more light on that. Could remember, I saw where you wrote something about recti something. I think it's root of administration. Is that I want you to just throw more light for me there. Is that any drug being
There are some drugs that we have by rectum and we have by vagina too. There are some drugs that the ladies know that there are some drugs that are administered through the vagina, some drugs that is administered through the anus. So they are available. but most of them are not ophthalmic drugs. There is no ophthalmic drugs that they administer through the anus. But is the reason why I put that abbreviation in abbreviation for prescription writing is for you to know it as a doctor. So that when you're reading a prescription of somebody and you see it, you tell this person that this means by rectum, this means this drug should be inserted through the anus. So that is the administration for that drug. So it doesn't mean that there is any ophthalmic drug that is by rectum, no.
Okay, thank you, sir. Thank you, Doc.
So any other question?
Another question.
Vic-
You were saying about drug stability. How do you know the drug stability?
Okay. Like I was saying, a lot of things can affect drug stability. So you can know if things must have affected this drug stability by you can look at it physically, the appearance. Like I said, most times if I'm administering drug, I first of all drop some of the eye drops on the floor and look at the appearance of this drug. If it is okay, I will know that this drug is okay. If this drug is already degraded, there will see changes in color and clarity or texture of this drug. So the appearance will tell you. Another thing, uh, size, especially when it comes to tablets or capsules. If it's a degraded drug or if it's a jelly drug, those drugs like vitamin, uh, vitamin C or vitamin A, that usually of some kind of a gel. If they degrade, it reduces the size or it changes shape. So the changes in shape or size can tell you that this drug is degraded already. So another thing, another way is also viscosity of that drug, the texture, how the texture is, the thickness. If there are changes, if the drug is supposed to be thick, is now watery, you know it has degraded. So that is one. Other ways of checking for this stability involves um, lab checks. So there are other ways, chromatography, spectrometry, sterility tests, done by microbiologists to check if this drug is infected and the rest. So others are, but the most common way is physical assessment. So check for the appearance, check for the size of the particle or the size of the drug or the shape of the drug. If there is any changes, check for the viscosity. I think this should answer your question very well.
Exactly. My own question is based on ointment.
Mm.
I think you mentioned something about it not being like it's majorly administered at night. I think due to its side effects of causing blurry vision. Why is that so? Why can't it be administered in the daytime? And
Ointment is
why is it not more regarded? Like why is it not more used like the topical ones?
Yeah, ointment is a topical administration now, so it's applied on the eye. So it's not it affects because it's an oil is oily. You know,
Okay.
when you put an oil on the eye, it's the eye becomes oily. I know oil drops visibility, especially when you put oil on a glass, so that the picture of that glass reduces. Let's give you an example of how it looks like. So ointment are solid in nature, so it affects. Another thing also, most of the glaucoma drugs that are eye drop, especially the prostaglandins, they also they're also oily, also a little bit oily. So that is why most of them are administered at night. Especially the prostaglandin are administered one daily at night because of the the oily nature of how it is. The solution, so it's also light once daily in order not to affect the vision of this patient during the day. So any drug that is oily in nature, once administered, it affects vision.
Thank you so much.
So okay, Amechi said you said suspensions are like are likely to leave a sandy after effect. Is that a bad thing or signify the medicine is actually working? It's not a bad thing. Suspension contains particles, finely divided particles in it. So those particles can cause some kind of friction on your eye. So you just feel a little bit discomfort at the moment, but those particles will get dissolved after some time and you stop feeling the sandy sensation. So it's not a bad thing. So it's how the drug is made. You understand? So, Anne, can we hear your question?
Okay. You made mention of issues affecting drugs, that may be changing drugs from one container to another, and all the rest of them. Um, some of the drugs that when you go to a chemist shop, like they will remove them and put it inside a paper or drug envelope. Does it mean that the drug is not like, how will I put it? It's no longer effective.
Yeah. So, if that person, if the pharmacist is a good pharmacist, there are some drugs this pharmacist will not put in a drug envelope, especially those drugs that comes in a container that is amber in color. That amber color of that container means this drug should not react with light. So they will not, and most of these drugs are not prescribed in some in counting. They're not prescribed counting. They're usually prescribed in cups. So it's either the pharmacy will tell you buy this social amount of cup, take this cup. So you should leave the drug stored in that cup. So those drugs that are given in envelope, it's though it can be affected by sun, but before the sun will degrade the stability or the effectivity of that drug, you are done taking the drugs. You understand? So that is why it's not good to buy drug in envelope and store it and keep it. No, you don't store drug in envelope. You are degrading the drug. The drug will you degrade the drug before you take it the next time. So once you are giving drug in envelope, you should be the complete dose and you should finish that drug immediately, not to store that drug in that envelope. Understand? So drugs are not stored in drug envelope. Instead, they are they are dispensed in drug envelope to be taken immediately for a period of time. You understand? So now transferring drugs from one container to the other, maybe one one cup to the other. If the drug was formerly in an amber color cup, transfer it to a transparent cup. You are doing that drug harm than good. So the drug will degrade. Will degrade. I know transferring drugs from one container to the other, exposing it to air, exposing it more to air. So you don't do that. Another reason too, we don't store drug in envelope because once you put it in envelope, air goes in with it and you seal it with the air. And the air will begin to degrade that drug. So you don't store the drug. So you take that drug till you finish. You understand? I hope that answers your question.
Yes, yes.
So I'm going to ask your second question.
So I'm not going to say I had a patient because it wasn't my patient, but I had somebody here who was using herbs to treat their eye issues, and I don't know if they used to drink it or they put it in their eye. I don't know. But the person was always saying when they wake up in the morning that they felt this sandy sensation in their eye also. That's why I asked my last question also,
Uh,
if that's a good thing or not.
Herbs, herbs are not applied on the eye. Herbs, there is no ophthalmic drug that is a herb. In practice, optometrists don't prescribe herbs. So anybody that is using herbs to treat his or her eye condition is treating it on its own. So it's not the prescription of a doctor. So in fact, why this person is feeling sandy sensation, there are many things, many reasons. One is either the herbs contain suspensions, and this suspension is causing the friction, the sandy sensation. Secondly, these herbs, these herbs, when these drugs we prescribe, most of our ophthalmic drugs, they are they they are manufactured with a specific pH. They are manufactured with a specific concentration. They are manufactured with a specific dosage. They are manufactured with a specific percentage. That's why you see some drugs 0.5%, some drugs 10 milligram. But these herbs doesn't have any dosage. They don't have is an unknown pH. So when you administer most of these herbs, you might be administered the herb that is very acidic, and you might end up corroding the eyes. This patient might end up corroding the eye, or might end up administering a drug that is as concentrated as an orange. Orange is very acidic. Just imagine applying a drop of an orange juice on your eye. You run mad. So most of the acidic drugs causes dry eye, and one of the symptoms of dry eye is sandy sensation. And if care is not taken, if it continues, it can cause corneal abnormalities. It can cause corneal keratitis or any corneal abnormality at all. Because when we administer acidic drugs for a very long time on the cornea, it damages the cornea. So you see, herbs are not to be administered topically. I don't know where they are getting those information from that they administer herbs. That is why we are always agitating against this herbal tea. It's now rampant online. Herbal tea cures cataract, glaucoma, myopia,
Yeah,
hyperopia,
it's
all the
online that
conditions,
they saw that.
all the eye conditions in the world. That is very bad. Most of them will apply it on their eye, they will drink it, they will even use it to bath. So I've seen a lot of them in the clinic. They will come, after speaking with them, it's like, doc, there is one of these drug I saw online. They say it can cure this cataract you're talking about. So I'll say, let me see it. They will show me it's herbal tea. I'll be like, wait, what the heck? Where on well, when you start practice, you will see a lot of them.
No other question, I guess. So, in the absence of that, Dr. Franklin, I want to use this medium to thank you so much for bringing out time to lecture and educate us on ocular pharmacology part 1. Special thanks to you for the insightful lecture and to everyone that participated. I really want to thank you all, especially. Thank you so much, Dr. Franklin. Thank you so much. God bless you.